All right. Well, I am showing 12 o'clock. I think we'll get started and we'll have a few others that join us as we go. Good afternoon and thank you for joining us today. My name is Jeff Ray. I'm the president and CEO of the South Bend Regional Chamber. We're grateful for you taking a part of your Monday to hang out with us. Obviously, during COVID, we've tried to adjust and stay connected with our members, and we have shifted our networking at lunch to virtual. So sorry, no good lunch for you today. Hope you packed something good in your own lunch bag there. Sorry, we couldn't get together and do this. One of these days, we'll all be back together gathering. But in the meantime, we'll continue to do things like this where we get together virtually. And we have a great conversation planned with you today. Before we get started, though, we can't do the events that we do at the Chamber without great partners. And our partner this year on networking at lunch has been Gibson. And Becky Beckman from Gibson is with us. And I'm going to just turn it over to Becky for a quick hello.
Thanks, Jeff, and hello to everyone today. As always, Gibson's very excited to be a part of this event and all of our chamber networking events. We're so proud to be a part of the community and partner with Jeff and all of the great people that you guys have brought on and how you've had to pivot to virtual. It's still been wonderful, and thank you for continuing to bring these people to us. And I look forward to hearing Larry talk today. So thanks so much, everyone.
Great. Thank you, Becky. And thanks to the Gibson team for all the things that we get a chance to do throughout the year. Really appreciate that. A great role model for other employers. And so if you want to find out more about Gibson and the work they're doing, please reach out to Becky. She'd be happy to share more about the good work that they're doing there. So we have, tried to bring you a wide variety of topics, obviously, to keep you interested in. We thought today an update from the healthcare systems would be critical. In particular, as we're watching the news and COVID cases are spiking and new things are happening kind of around the country, we thought we'd go right to the top and invite Larry Tracy to join us today. And if you don't know Larry, you should. Larry's a terrific leader here in our community. Larry is the president of Memorial Hospital here in South Bend. And Larry and his team are doing a phenomenal job on the front line helping us navigate the COVID crisis. And I have a chance either every day or almost every day to interact with some of his employees. And he's got some terrific frontline folks doing some great work. And I'm sure he'll mention that a little bit. But Larry, I'm going to just bring it into you. And actually, one more thing, just remind you, if you have questions for Larry, we would encourage you to use the chat function. I'll try to navigate that there and monitor that and try to ask your questions. But but Larry, I'm going to come your way first. And Larry, if we could just start with just a view from the front lines, if you will. You're on the front lines of the fighting the virus, and we've watched the news. But give us the kind of the current state of COVID and kind of what you're seeing at the hospital and here in our community.
Sure, Jeff, and good afternoon, everyone. Thanks for having me. I would be remiss if I took credit for being on the front line. My staff don't want me anywhere near a patient, and with good reason, as they're all exceptionally well trained. And while I'm well trained, I'm not trained in the same things that they are. And Jeff, I would summarize it as if I had to pick one word, it's bad. Just for us in Beacon Health System this morning, I woke up with 193 people between Memorial Hospital of South Bend, Elkhart General, Bremen Hospital, Beacon Granger Hospital, who are either positive or who are suspected of being positive, and therefore we have to treat them as if they're positive. And for the staff, there is no difference between someone who's positive and someone who's suspected, because they have to take all the same precautions and the like. So, and what's making it bad is our staff is getting exhausted across the health system, and not just within Beacon, but as I talk to hospital leaders across District 2, which is the northern part of the state. So my colleague Chad and the folks over at the Mishawaka Medical Center, talk to Randy down at Goshen and others. Our staff are getting to the point of exhaustion, and we had a very painful reminder about 6 weeks ago when we lost a young, vibrant nurse who was in a one-car accident on her way home after her night shift. And this is exhausting work. And so we're getting to the point where, in order to be able to effectively take care of patients who are infected with COVID, we actually have to redeploy staff from across the health system, which means we have services that we can't offer to our community. And so that ratcheting down of services is actively happening across all of these health facilities. And we are to the point now that we are not doing anything that's not like a trauma, a stroke, or truly emergent work. Everything else has been put off in order to be able to take care of COVID patients. And as we saw for the first time back in the March, April timeframe, that has an unintended downstream consequence long-term to the health of the community when they're not getting care that doesn't fit that criteria. So we are very concerned here in Northern Indiana with the state of where we're at from a COVID perspective.
Larry, thinking ahead, and obviously the news over the last couple of weeks, we set a new record almost every day, which has to alarm you even as things go out over the next couple of weeks. We're obviously heading into a holiday season where people are getting together. What worries you most about the next couple of weeks and the direction that we're headed?
Yeah. There's a lot. First and foremost on my mind, obviously, is our staff, because if we don't have them, then the community can't get the care that they need. But to be honest with you, there's so many things to worry about that. We're fighting a combatant that you can't see, you can't feel, you can't touch. You get it and you can't smell or taste, but as a result, it's I think it's very. I'm concerned about the fact that we're fighting an enemy that you can't see, and as a result, from a public perspective, we are having a hard time getting our hands around getting people bought in to what is in the best interest of the health of our community. And without being able to do that, that enemy combatant continues to spread itself and infect us and have the impact that it's having. So that's my greatest concern, is that we don't seem to get it in a variety of different venues across the region and across the state.
Great. Larry, I know you're not on the medical side, but I think, being at the hospital, you can help give us some perspective there. Help us understand, so folks who don't know somebody who's had COVID maybe aren't understanding, kind of what they're going through and why they need to be in the hospital. So can you give us some perspective of why it is COVID patients need to be hospitalized in some cases, and the kind of care or treatment you're needing to do for them?
Sure. So this is basically at first we thought it was only a respiratory illness, but what we're finding is that while it is a respiratory illness, a virus, what it does is it exacerbates so many other underlying medical conditions. So, and you may hear it called comorbidities. And so whether you're talking about someone who's got congestive heart failure, chronic COPD, chronic obstructive pulmonary disease, any variety of comorbidities, including being diabetic, being obese. And what happens is the virus ends up attacking the body and putting it into a state where it can rapidly deteriorate, meaning we will measure oxygen saturation. In other words, how much oxygen is actually permeating, going into your blood, and then it's getting circulated through your body. And when those saturation rates go down, it has a detrimental effect to other parts of the body, not just the lungs, but all across the body. And so you can have a patient who comes in who's vertical and within hours is horizontal and then progressing to the point that they have to have anywhere up to ventilation. And while we've learned a lot during this process, and we don't get people, we have other ways to help with their oxygen saturation prior to ventilation. It's still a daunting task because there's only so many resources to go around. And as a result, we're to the point where thankfully we have a very strong ethics committee that helps us in the decision-making process about how to rationalize those resources. Unfortunately, that means some people are getting the highest level of care, and in some cases, unfortunately, some people are not. For a caregiver, what you have to do is you have to protect yourself. And because of the way the virus can be transmitted, they have to take precautions that they otherwise on a day-to-day basis would not normally take unless it was an infection like TB or something that is in much smaller quantities. So it requires an inordinate amount of what's called PPE, personal protective equipment, which ranges in everything from gloves to eye protection to gowns, PAPRs, which are these hoods that you have to put on that have that circulate air, and basically creates a protective layer so that you yourself as a caregiver don't get the virus. And it dramatically slows down the speed at which a care provider can work. It also is a great emotional toll because people get claustrophobic. I remember dating back to my first career as a United States Army officer, and there's a lot of scenarios I trained for, but the one that always felt the most uncomfortable was nuclear, biological, and chemical training. Because I'm in a charcoal suit, I'm in a hood, and it is a lonely experience to be isolated in that way. It's hot, it's sticky, you don't function as well as you normally function. And so the wear and tear that it takes on the person, both psychologically and physically, is palpable. And then when you combine that with more and more patients, it just becomes crushing for you as a staff member.
Larry, in the spring when COVID was first arriving, there was a lot of discussion about the need to build a MASH hospital or something like that. Do we do something at the Century Center given the the rising number of cases, and then those plans went away. Now cases are spiking again. Start maybe two questions. One about whether that kind of discussion is continuing, and then second, maybe internally what you're doing to accommodate as many patients as you can inside the hospital.
Yeah, thanks, Jeff, and thanks to your leadership. For those of you who don't know, we asked Jeff to take on a pretty thankless role in terms of trying to connect the dots, if you will, between government agencies, social service agencies, the hospitals, et cetera. And Jeff, I just want to commend you for really stepping in with both feet and your nose and getting at it. You've been a great advocate for our public health. And so, the idea of sort of a MASH hospital type setup, which is what we saw in New York and some other places, we did vet that through. The challenge, quite frankly, becomes the ability to staff it because ultimately there aren't the human resources necessary to be able to staff both a regular hospital and a field hospital. And some of the lessons learned for some of the care providers that have come back into the state of Indiana who deployed into places such as Texas and New York and other places, the efficiencies, the effectiveness of those hospitals is pretty marginal. So I won't say that we would never go there, but I think it's far less likely. And instead, what we've done is reallocate our resources. So for example, we have to expand the number of critical care beds that are available. So what that means is we have to find other space within the hospital that has that same clinical capability, medical gases, and the like. And as a result, that ends up being our post-anesthesia care unit. In other words, the area you go to after you have surgery. And so we turn that into a mobile ICU. Well, when you take that capacity offline in order to be able to care for somebody after surgery, that means you can't do as many surgeries. So there's all these sort of downstream consequences that happen. And if there's a day where we reach such a critical level that we have to have sort of a community mobile hospital, it's more than likely, at least the guidance I've gotten from the state, is everything else in this community would have to be shut down. It would have to be so dire that that they would likely send in the National Guard, which means we got to centralize it to one location. And I think we've got a couple of options that are on the table. As you mentioned, the Century Center was one of those locations that we looked at. St. Joe has a facility down Elm Road that they no longer use, which is a 40-bed unit. So I think we've got some options. But right now, all of us are trying to reconfigure space within our hospitals that in order to be able to sort of keep things on our campus. And I'll tell you, it's resource intensive, both in terms of time and in terms of money. Something as simple as the air that you breathe and what direction it's going, whether it's coming into the room or going out the room, how you filter it, all those things requires a lot of engineering controls, et cetera, that you don't just, with the flip of a switch, turn overnight unless your facility was designed that way. And obviously the age of the facilities here, at least at Memorial and at Elkhart, is such that we don't have those capabilities built in yet. So it takes us more time and effort in order to be able to convert those spaces.
Great. Larry, I want to shift to talking testing. So you have, your organization has been out on the forefront helping folks get to test. You've got a lot of employers on the line here today that are wrestling with that. When the safe practices in the workplace, when do they get people tested? How do they get tested afterwards? Can you just talk to us a little bit about your efforts on the testing front?
Sure. There's our testing sites tend to be at our MedPoint locations. We've also got testing that's going on with select large employers that we've been engaged with, most notably in Elkhart County is the ones that come to mind most readily. And those sites have, I'll say, extensive lines with people who are getting tested. And we still have two different types of tests. One sort of a standard turnaround time, which today still tends to be somewhere between 5 and 7 days. And then we have rapid testing, which ideally can come back in a matter of hours and will typically, and by the way, the availability of those tests is allocated on a national level. So we don't control the supply chain. And as a result, we tend to limit that type of testing to emergent cases that are coming in. So we know whether our staff's going to be exposed to, if they're urgently taking care of that patient. So, but testing continues to be a challenge all across the country, and our region isn't any different.
Great, thank you. And you I appreciate in particular your response to communities that maybe are underrepresented or underserved. You've done a great job of getting out to those, as have the other healthcare partners in the area, but really appreciate your leadership on that. Larry, as I mentioned, 50 plus employers, with us, and so talk to them a little bit. Obviously this health crisis has created a economic crisis as well, and so we sort of have this balance of trying to keep the economy up and running, but also keep people healthy. Talk to these business leaders about the things that they can do in their workplaces to help you on your end, on the other end of sort of treating the patients.
Sure, and if you'll allow me, I'll just tell you my bias is up front. I'm trained as an economist by background, my undergraduate education. I am as pro-business as business gets, and I don't say these things lightly, but I get it. I get the challenges that political leaders and business leaders face, because the health of your business depends on the ability to conduct business, quite frankly, and keep people paid and keep product and services moving, et cetera. And I get it. You know, I would come back to the basics. It comes back to wearing a mask. And I'm embarrassed that we've allowed ourselves as a country to politicize the wearing of a mask. It is the most basic, fundamental thing in terms of spreading the virus. Now the research is started. At first, we only thought that the mask protected others because of the exhalation, the coughing, et cetera. And now what we're learning is that most masks actually also protect the wearer. And so, you know, we feel really good about that. But yet we have a hard time, we struggle with this idea of a mask. And I have an 18-year-old daughter who's a senior in high school who happens to work at a local business. And she sees that struggle on the front line every day as she deals with her management trying to enforce the fact that you shouldn't be entering the business without the mask. So between the mask wearing, the social distancing, washing your hands more than your mother ever told you that you should, those are the basics in order to be able to effectively stop this spread. You know, as employers, and we feel this crunch as well, you know, there's this balance between accomplishing your business objectives and actually accomplishing your business objectives a lot of times depends on the culture of your organization. You know, they say culture eats strategy for lunch, right? And I get it that when your team's not together, it can negatively impact your culture. And what I would encourage business leaders to do to the utmost extent that you can is figure out how to drive your culture through remote work, through the practices, whether it's the wearing the mask at work, the social distancing at work, et cetera. I mean, we're doing the exact same thing within our walls. You know, normally I'll have a room, my safety huddle every morning, which is sort of like our business huddle. It's like, okay, what's the major things we got to get done today? What are we worried about, et cetera. That event normally carries somewhere between 70 to 80 people, you know, every morning at 8:30, and I can't run it the way that I used to. And we've had to figure out how to put people in different conference rooms and connect them virtually. And it's a challenge. But as a business leader, setting the tone comes with the direction that you and your senior team take your organization and the message you send, whether that's overtly or whether that's through other forms of persuasion. And it starts with leading by example, and then imposing your will onto your team. You know, I'm recalling early in this pandemic, Amy at Martin's, you know, what a struggle, because here she's dealing with this outside clientele and right, and all the politics that are going on. But it really came down to, what can I control? I can control the folks who walk in my door and get a paycheck from me, right? And setting that tone. And then as society sort of caught up, you know, Martin's was very well positioned. And so that would be my encouragement to you is to really lead by example with your businesses. And, you know, I know that sometimes there can be this fear that, you know, if I do the hard right, maybe I will be negatively impacted from a business perspective. I remember these arguments years ago when the whole smoking indoors thing was coming about in restaurants. But the bottom line is, as we've seen, if everybody does the right thing, equilibrium eventually sets in. And I know it's hard to do the right thing when others aren't doing the right thing. But the other thing I would encourage you, and I've already started this, I've already walked out of businesses, local businesses who weren't doing the right thing. And I just made it clear, I won't do business here, including getting my truck serviced. I took the truck out. I'm like, nope, I'm not going to let you do it because I see that people aren't following. Money talks. And I would encourage you to consider the same, that and eventually people will get it.
Great advice, Larry. Thank you. Appreciate that. So, one of the exciting thing, I don't know if exciting, but encouraging things that we're seeing on the news is the vaccine development, and quite a few companies are working on that, and a lot of different, stories about when that might be available, how soon it might be able to widely distributed, that kind of stuff. Can you give us, obviously, I think you guys hear and see some of that kind of stuff. What kind of update could you provide us on vaccine?
There's really sort of two streams, and they are different. One is the prevention, and then the other one is the treatment. I'll address the treatment first. You may be hearing news about the antibody treatment that Eli Lilly is coming out with, and Indiana is one of the early adopters in deploying that. And that's actually, we may have that antibody treatment here in our community by Friday. The southern part of the state down near Louisville was the first to get it. And they've already treated a couple of patients, but Eli Lilly is partnering with communities over a 3 to 4 month time period in order to be able to push this out. And so we're actively working, St. Joe, us, Goshen, and others. It'll be a centralized community site, and it'll be active patients who have COVID, but then to be able to treat it. The really exciting thing is the potential of a vaccine, and the word of caution that I have for everybody is a 3-letter acronym called EUA. It's called Emergency Use Authorization, which means that whoever's operating under the EUA doesn't necessarily have to meet all the same requirements that they would normally meet in order to bring a product to market. And I think that's going to be probably one of the most challenging things that we deal with. Is again, you get back to the politicalization of this, and the trust factor. Where we've gone from a national level on the political spectrum, I'm not sure if I was the average Joe American that I'd know which way is up and who to believe, quite frankly, in all this. But it looks like we could have a vaccine. We've got a couple of different manufacturers who look like they're in that 95 to 96% effectiveness range that could have a vaccine in the state by the end of the year. And we're actively working with the state on what those requirements are. The first manufacturer, which I believe is Pfizer, is a bit challenging because it requires ultra cold storage at minus 94 degrees. And so I don't have a lot of refrigerators that have that capability. If any of you have them and would like to volunteer them for the community service, I would welcome it. But otherwise, we got to handle it. It's a very time-sensitive matter, and handle it with dry ice and some other things. And the other one apparently doesn't require that ultra cold storage. But really, those are on the horizon, possibly by the end of the year. And into Q1, but it's and we still don't know yet with whatever vaccine is developed, will it have long-term effect, or will it be like the flu where we're sort of chasing a variant of this every year? But even if we could get it to flu-like administration where it becomes annual and it likely just gets embedded in the flu vaccine, it'll get us back to a sense of normalcy versus what we have today. And so we are excited about both of those manufacturers seem to be getting really close to being able to release those.
Great. Larry, you mentioned the word normal, and I think that's the thing that most of our business folks are saying, and obviously it's hard to predict, but looking into the future a little bit, I think this obviously caught a lot of people by surprise. Is there a likelihood that a year, 2 years, 5 years from now we have a COVID-27 or next issue? How does this pandemic teach us to prepare for future viruses that could attack us similar to this one?
Yeah, that's a great question. And if I had the answer on that, I'd be placing bets in Vegas before I answered it here. I don't want to sound like a pessimist, but one of the unintended consequences of all the advances we've had in our society from a medical perspective is that then as things mutate, they become harder and harder to then anticipate and or directly attack sort of in the moment. And unfortunately, I think we're going to continue to have to deal with this sort of scenario for well into the future. I don't see any scenario that says that we could properly anticipate, prepare, stockpile, et cetera, and not have an issue become an issue like COVID has. Unfortunately, when we look, go back to the Spanish flu in the early 1900s and other things, I think history, if you're a student of history and you say you're doomed to repeat it, I think it's going to be an issue that we continue to deal with. I do think, though, that, and I don't have any science behind this, but just it's an observation. I was at a point a few years ago when I would travel, and particularly when I would encounter, and I'm not going to say this the right way, so forgive me in advance, but when I would particularly encounter people from Asian cultures, if they were from overseas, and they'd be wearing masks, and yet there's nothing going on wherever I'm at, somewhere in the United States. And I really didn't understand, were they afraid of us, et cetera. And what I've come to appreciate is they've been dealing, in some of the Asian countries, they've been dealing with these mutations and these viruses long enough that it's become a sign of respect for others that, yeah, I may not be feeling well, or I might be sick, and I want to protect you. And I think that's something culturally that we may, if we're truly in this collectively for each other, that we may have to adapt to, is that we may need to find ways to protect ourselves and protect others by sacrificing something on our own. And whether that's the liberty that goes with a mask or what have you, I think that's a cultural challenge we're really going to have to address if we want to try to head off some of these virus transmissions. So, but unfortunately, as medicines develop and then you administer them and then the body no longer reacts or is less effective with those medicines, and then something mutates, it becomes harder and harder and harder for us to develop things that can effectively vaccinate or combat these viruses.
Great, thanks, Larry. Let's go back to talking workforce for a second. And obviously, you have the today challenges of staffing, for your current need, but you also have the tomorrow challenges of continuing to develop your workforce to develop this. Talk a little bit about how something like this changes your industry. Does it compel more people to want to sign up and help? Does it compel less people? Do you think there's long-term impacts on your industry, on the on your ability to attract healthcare workers?
Yeah, it does. And unfortunately, unlike 9/11, I don't see a line of people standing out our employment office, real or virtual, looking to sign up to serve their country in the form of provision of healthcare services. I would tell you, you're right. I mean, we've got ambitious plans, even in the face of the pandemic, for Beacon Health System, and our workforce demands are going to continue to escalate. I think the challenge for us is really the same as I talked about earlier. It's about transforming our workforce to be agile enough about where they work, how they work, in order to be able to minimize exposures. But unfortunately, the lead time on healthcare training is years. In the military, I could convert someone from being a civilian to a soldier in 6 to 8 weeks, then give their specialty training, give me another 4 to 8 weeks, or a little bit longer. So I could measure it in weeks. I can't produce a healthcare workforce in weeks. I can in some select specialties, but when you're talking about a nurse, a doctor, advanced care providers such as nurse practitioners, PAs. That's measured in years, and unfortunately, I don't see hope on the horizon. We've got challenges in terms of aging faculty in our training settings, colleges, universities, and other training settings. Typically, the number one impediment, for example, to nursing school enrollment is the available of nursing school faculty. And so developing that workforce is becoming increasingly challenging. I will say, though, in my own household, my 16 and 18-year-old daughters seem to be motivated. One wants to be a physical therapist, the other one wants to be a neurosurgeon, and this pandemic has not made them back off of that. So I'm hoping that all of you have kids out there that want to be that next whatever in the healthcare space, and if so, text me, because I'd like to start that pipeline as early as I can.
Great. Larry, so Thanksgiving is coming up. We talked briefly about just the politicization of these issues, how contentious it can be. I think at family gatherings, obviously it can be contentious too, with people having a difference of opinions. As as we watch the news every day, people are just polar opposites on what's going on. Any advice to people as they're gathering with their families on how to deal with COVID when it comes across at the dinner table or on their family Zoom during Thanksgiving?
Yeah, I mean, I personally, my recommendation is to go into Thanksgiving with a whole lot of grace. We have a lot to be thankful for. We live in a country that allows the freedom of expression, that allows businesses to innovate, allows all of these things, and yet we're in a pandemic and we want to arm wrestle over whether or not to wear a mask. And I would say go into Thanksgiving with a whole lot of grace, and be thankful, whether it's in person, socially distanced, of course, or whether it's on Zoom or whatever, FaceTime. Be thankful that you're looking at that family member across the aisle or across the computer screen, because I know many people who've been affected. I've lost 2 family members this year, my father and my aunt. And I know that when I see my 90-year-old grandmother on FaceTime for Thanksgiving, and her and I don't see eye to eye, and she's a retired nurse. Her and I don't see eye to eye on a lot of stuff. Quite frankly, I don't give a darn. I'm thankful that she's going to be on the other end of that FaceTime call.
Good advice there. Thank you, Larry. So Larry, let's talk. Beacon has built a couple of health and lifestyle centers, which have become really terrific places for people to gather here in our region. Obviously, we want people to be healthy and continue to work out and do all the things. At the same time, we want them to help keep people around them. So I'm just thinking masks in particular. I have a question in the chat about masks and about wearing of masks in the fitness centers, and kind of the thought process you go through about sort of when that is appropriate and when that's inappropriate.
So we have re-implemented the mandate of masks in our health and fitness centers because the community spread has gotten as high as it has, and we had taken other precautions in terms of distancing equipment and all of those things, and it still wasn't enough. I will tell you, as we're preparing our 2021 business plans and our budgets, a big challenge in the health and fitness space because people, appropriately so, are concerned about that. And I would say that your overall fitness is, I think, very important in terms of keeping you at the top of your game as a business leader. And it's also important for your staff in order for them to be the best that they can be. And so my encouragement would continue to be, go somewhere that you have confidence that they've put the appropriate measures into place. Do the appropriate things, even if the rest of the members aren't, in terms of masking, hand hygiene, distancing, and realize that potentially the social component that many of us enjoy when we go to a facility like that likely isn't going to be the same. I mean, I joke that we have quite an active social club at our downtown health and fitness facility, because there's a group of seniors there that was part of their routine, catch up with their friends and do that sort of thing. And yeah, that component might be gone, or at least it has to happen at a distance. But I would encourage everyone to continue with your workforce to find ways to stay healthy, both physically and mentally, in order to continue to tackle the challenges that are associated with this pandemic.
Great. Thank you, Larry. So just a quick reminder too for our visitors that Larry Tracy, Larry's the CEO over at Memorial Hospital, and doing a great job with us today. If you have questions for Larry, feel free to throw those into the chat. And Larry, we're really grateful for your time in particular and for your honesty with us on so many challenges. Larry, let's just talk health in general, because you're in the business of trying to help keep people healthy and take care of them when they're not. And obviously COVID makes people think twice about going to see the doctor or whatever. It's changed. So what kind of advice for folks as they're in terms of how they're managing normal health stuff at the same time the pandemic's going on?
Yeah, it's a great question. It's one of the looming things that bothers me about the curtailing of services. I get some of my friends who think it's about the business aspect, and the business aspect doesn't bother me. It's the long-term implication it has on people's health and the health of the public. And I would tell you that if you don't do the right things to take care of yourself, and if your folks don't, they're not going to be here long term in order to be able to tackle whatever other challenges that you want to do. And you know, I'm a firm believer that the healthcare systems around here are doing the right thing. They're taking the right precautions. I actually think that it's safer to be engaging with us and getting services today than what it was back in January or December of earlier this year, because we are cleaning everything. We are following all guidelines plus some. And so I would hope that the members would have confidence that their local health systems are going above and beyond to create the safest environment possible. Now, at the same time, some of our providers are needing to be redeployed. And so I would encourage you, if you're finding a longer time to get in to see your physician, if you haven't used a virtual connection method. So for us, it's Beacon Connected Care, and I know St. Joe's got one as well, and Goshen, but South Bend Clinic has one. Don't be afraid to use that, because a lot of the diagnostic tools are, you know, physicians and other providers can still figure out the vast majority of things, you know, the aches, the pains, the sniffles, et cetera, that you've got. And don't be afraid to use those platforms, because within minutes, you can have that conversation with the provider. A prescription can be sent to wherever, you know, you prefer, and you can get back to feeling better. But I would also tell you that if you're feeling aches, pains, et cetera, that you're not used to feeling, if you felt a lump somewhere that you're not used to feeling, don't think that putting it off and waiting for this thing to subside is the answer. It's not. We are seeing people who have put off care because they were afraid of what they might get exposed to. For the vast majority of people, unless you have a lot of comorbidities and you're on the older end of that age spectrum, for the vast majority of people, getting exposed to the virus and ultimately contracting it, still long-term is not as bad as if you felt that lump and you didn't do something about it. And so I would encourage you to actively engage with your provider, be honest and open with them, and let your provider help guide you as to how to address whatever it is that's ailing you or your employees.
Great. Larry, question about the data. So the state of Indiana has a dashboard that they update every day with information about our counties and such. And so, so our citizens are, kind of keeping track of what's happening around. However, the data now seems to be really lagging. It's 4 to 11 days old, which in an environment where it's growing like crazy doesn't seem like it's very helpful. Can you just talk a little bit about just sort of the data and kind of the update or the information you're tracking there?
Sure, I'm going to try to do this. Let's see if that works. Can you all see this screen that says Indiana COVID report?
Yes, sure can.
So as you can see, this was last updated on the 14th, which was a couple of days ago at midnight. And I haven't refreshed the screen since we got started, so it might be, it might have, let's see, am I lucky? Maybe not. Oh, look at that. We picked up an extra day. All right. So this is a site that anybody can access, coronavirus.in.gov. And then you just click on the, right here, on the Indiana COVID-19 dashboard and map. And one of the things that I find helpful when you come down is I actually tend to focus in on, I tend to focus in on District 2 because that's our district. The question becomes, how long does it take for the site to load? And but then what you start to see here is, I mean, you can start to see, although they haven't updated, oh, here we go. So in St. Joseph County, we're looking at a 7-day positivity rate that's climbing up at 11%. And the difference between that and the unique individuals is just that. It's people who, just one test versus, because sometimes people have multiple tests. Up in Elkhart County, you can see it's getting even worse at 34% in terms of that 7-day positivity rate. And then you can scroll down and you can start to see the trend line in terms of the number of positive cases, the number of tests, and the like. You can also see the demographics, both for positive cases, for deaths. As you can see, it tends to be, once you get across that 60 threshold, much more of our deaths happen 60 and older. You can see the demographic breakdown, and then you can see some of the hospital utilization. And this is probably the chart that is the most concerning, and that's this rise in the total census of COVID patients, which peaked on September 11th. And the reason I'm not feeling really comfortable right here, Jeff, just as you mentioned, is the lag time. So as the days go by, this, at least based on our numbers, this won't be a downward trend. This number will continue to go up to the right. So it's a site that's readily available to anyone. And let's see if I can stop sharing. But yeah, the lag time is concerning for us because, we're looking for any indication that we're going to stabilize. Because if we can stabilize and start to move those numbers downward, we can then start to re-gear ourselves to take on things other than urgent and emergent care, and so that people can come back to getting their health care taken care of.
Great. I got a question, Larry, about tests. So the rapid tests, how accurate are those? There's been a lot of talk about just testing accuracy in general, but some of the clinics are offering the rapid 15-minute tests. So like the walk-in emergency clinics. So are the tests in general to be trusted?
So yeah, the accuracy is there's two different types of rapid test. And I'll just say in general, the faster it comes back, the more you have to look at things with an eye of caution. If the rapid test comes back and you're positive, I would have a high degree of confidence that you're positive. It's if the faster the test comes back and you're negative and you have symptoms, that's when we find ourselves going to other more reliable testing that usually takes a little bit longer to come back. And so that's why, for example, you see that positivity rate, the difference between 7-day all tests versus 7-day unique individual tests.
Larry, while we're talking testing, I'm more of a question related to labs. And so you mentioned earlier the return time for these tests. And the question really related to other tests that go to the labs. Are the labs so overwhelmed that every test is affected, or does COVID get kind of separated out? And if I was, having a test for something else, is that kind of on a normal time frame?
We have not seen a degradation of our turnaround times on non-COVID labs. We've got really strong partnerships, both with South Bend Med Foundation and their new parent company, if you will, LabCorp. We're seeing consistent turnaround times on the other labs. Every now and then we may have an issue, but quite frankly, when you look at that and you look back over time before COVID, it's about the same incident rate that we would have had and when something else would have perhaps delayed a lab coming back. So we're not seeing a degradation on our turnaround times on non-COVID labs.
Great. Larry, as we're wrapping up our hour here, any final words of advice to the folks? You've got, like say, 50 plus business leaders here with you. What final words would you leave with them?
Yeah, I would encourage you to take care of yourself. And this is just a personal belief, if you aren't finding ways to take care of yourself, you can't possibly long-term lead your organization, your business in the direction that it needs to go. Business leaders have to be resilient. They have to be able to problem solve, et cetera. And to do those things, you got to be taking care of yourself. And I know that can sound selfish in a moment like this, but I've seen too many of my friends and colleagues who think that they're going to burn every candle at every angle and go on forever. And long term, I've seen the effects that happens. And I think the other thing that I would just say is, and I don't know all of you, but what I have found is that the human connection right now matters. I think it matters more than any time. You can think about all the problems that people had pre-pandemic, and they got those problems, and now they got additional issues, isolation issues, et cetera. And the human connection really, really matters. This week, we're continuing our tradition of distributing a turkey to every associate in Beacon Health System. And thanks to Mark Harmon and the Stan's Food team, they're partners with us, because otherwise, how in the world would I find 7,000 plus turkeys? But what we've learned over the years that I've been here where we've been doing this, the bird's not what matters. It's about looking your associate in the eye, thanking them for a job well done, and connecting with them on a human level. So whatever way it is that you can find to connect with your teams, to let them know that you care about them as a leader, it'll matter more now than it ever has. So that would be that. Now this is me getting off my soapbox.
That's great. Larry, you've been very gracious with your time, and thank you for helping us better understand the COVID crisis, the things that you're doing and your teams are doing on the ground, and how we can assist in that effort. Beacon's been a really important partner of the Chamber for quite some time, and we're honored that Larry took some time with us today. We're really grateful. I would encourage you to visit Beacon Health Systems website or contact them at the hospital if you've got other questions along the way. I think there's a lot of great information out there, and we'll look forward to having you back, Larry, in better times for updates on how you have navigated all this. But we're really grateful for you today. So thank you, Larry.
Jeff, if I could, I'd close by saying thank you to all. By the way, I'm also a chamber board member. Jeff graciously allows me to serve. And it always feels good when I go to a business and I see that sticker on the window. And so thank you for being a member of this chamber. And thank you for taking the time to listen to me ramble on today for an hour.
Great, thanks, Larry. So just encourage all of you again. Thank you to Gibson, Becky Beckman, and Tim Lehman, the whole team over at Gibson, terrific partners with us as well, and appreciate you bringing us this event today. Watch your calendar. We'll continue to find great guests and different folks to keep you updated on what's going on. We want to stay connected with you. We know it doesn't make sense to do that in person right now, so we'll continue to do this as your safety and our safety is of utmost interest here, and we'll look forward to connecting with you again soon. Thanks for joining us for lunch. See you soon.